Now get ready for the test and follow the instructions. Tasks 1 to 4 instructions. You will listen to a short audio or video recorded conversation and answer the questions. While listening, select the correct answer from the options provided for each question.
Task 1, Patient Care. You will watch a dialogue between a nurse and a patient in a video scenario. You will get 45 seconds to read the questions.
Listen to the recording and select your answers.
Hello, Jim. How are you feeling today?
I'm all right, Nina, Pat. How are you?
I'm having one of those days, I'm afraid. So let's have a look at your chart. Okay, everything looks good. How are you feeling?
Much better today. I think the morphine has started to kick in.
What are you like? You don't need morphine. Jim, you just need to eat a proper meal. What did you have today?
Don't worry, I did eat my daily ration of slop today. I think they call it a hospital roast.
That was for lunch. What about breakfast?
Yes, I had the usual gruel.
Very good. Your vitals are looking better already. Do you remember much about the fall yesterday?
Yes, I do, Pat. I've been getting in and out of my Stairmaster without any problems for the last few weeks. I just had slip and tumble is all. Mavis called the ambulance, though, and here we are.
Okay, it looks as though you've sprained your right elbow. There's a little bit of a bruise forming.
Okay.
I'll make sure you get an ice pack for it. Are you in pain anywhere else?
I don't think so.
And your hearing aid seems to be working just fine. How long have you been using a hearing aid?
Around 5 months now. Right around the same time that I started wearing reading glasses, I think. No, actually, I got it before.
Okay, are you near or far-sighted?
I always thought a little of both. What's the one where you can't read things up close so well?
Ah, okay. Yes, it's confirmed in your notes. Hyperopia, it says.
Say so.
I do. Would you like your glasses now? I can't see them anywhere.
Mavis took them to get the frame changed. They were broken in the fall.
Okay.
Can I ask you, Nina, why all the interest in my feeding habits?
Mainly because of your medical history, Jim. We want to make sure that you're not malnourished. From your file, I can see you had a bout of dependency on drugs.
I did not. I was an alcoholic briefly, but I haven't touched a drop since '08. I swear.
I believe you, Jim. It's just that your condition means that you're at greater risk of developing malnutrition. We want to keep an eye on you is all. We don't want to lose you.
Oh, you are too kind.
Will your wife be coming back today with your glasses?
Not just my glasses. She's bringing Callum and Sophie too.
Your grandchildren?
Yes.
You must miss them.
Very much. I can't wait to take them fishing again or to the park. Those are my only hobbies now.
I'm sure they'll be just as excited to see you. Well, if you don't need me for now, I'll go and see if I can find you that ice pack. Try and keep the pressure off your shoulder and arm in general, okay?
Yes, ma'am. Will you come back later to see me before I go to sleep?
Yeah, if only to make sure you've had something to eat. You wouldn't want us to get the peg out, would you?
No, that won't be necessary. Just ask them to liven up the menu a little, would you? I don't think I could stomach much more of that slop they call food.
I'll see what I can do. In the meantime, let me fix your pillows. You want to make sure.
You will now have 45 seconds to review your answers.
Task 2, Patient Condition. You will watch a dialogue between a nurse and a patient in a video scenario. You will get 45 seconds to read the questions.
Listen to the recording and select your answers.
Could you please state your name and your birth date?
Why are you asking me this?
Well, I just want to make sure that you are who I think you are.
Well, that's a good idea. Ron Jones, December 15th, 1955.
Okay, and this is really just a safety check just to make sure I got the correct patient. And I do. My name is Sue, and I'm one of the nurses here.
Pleased to meet you.
Thank you. I'm going to just be asking you a few questions, a bit of a history, and I may be taking notes. It's just about that. So, what brings you to our clinic today?
I've got a cough, but I've had a cough for a while now. This past week, it seems to be getting worse, and I'm coughing stuff up.
Some stuff. Can you tell me about the stuff you're coughing up, or the sputum you're bringing up?
It seems yellowish, but maybe sometimes greenish looking.
And how are you feeling generally overall?
Well, I feel a bit tired all the time.
Okay. Are you having any fever or chills?
No.
No? Are you on any medications?
Yes, I had been taking some antibiotics.
Okay.
They didn't seem to do much, so I stopped taking them.
Okay, well, I'm just going to give you a little information. Antibiotics work best when you take the whole dosage. If you start and stop them, the bacteria might not be killed, and then it can come back and be a little bit stronger. And it's one of the medications where you should take the whole dose with, and it's usually only 7 or 10 days at a time, but you should take all of it.
Oh, I didn't know that. Thanks for the information.
Oh, no problem. Back to your cough. Are you a smoker?
Yes, I smoked for a long time.
Okay, can you tell me how many years of smoking that is?
2 packs a day, just about.
And for how long?
35 years now.
Have you ever thought about quitting?
Yes, but it's really hard now.
Yeah, I've heard that it is. I haven't experienced that, but I have some information on a smoker's helpline. Would you like to see that?
Sure. What have I got to lose?
Okay, well, to you before you leave. I know you've told me you don't have a fever, but I would like to take your blood pressure, pulse, your vital signs just before the doctor comes to see you. So is that okay with you?
Sure.
And I'd like to listen to your chest as well.
Okay.
Okay, good. Well, I'll get that ready. First, I'm going to take your temperature. Okay. So just stick this under your tongue. I'll hold it because it's kind of heavy. Shouldn't be beeping in a minute. Great. Okay. I'm just going to put this in the garbage. And I'm going to take your blood pressure. Now I need to climb up and grab this. You've had your blood pressure done before?
Yes.
Okay. So I need your arm. Just going to pull your... And I'm going to have to get my stethoscope. And have you had your blood pressure done before?
Yeah.
Okay. Do you know what it is?
No.
No. Now I'll take your blood pressure. Thank you. Now, lastly, I'll check your pulse. Excuse me. Okay, good. Thanks. Now, your temperature is 37. Your pulse is 88. Your blood pressure is 150/84, and your respirations were 16. Now, I need to listen to your chest sounds. It's the last part. I'll do that. Can you take a deep breath in? And breathe out. And again. And again. Okay, great. I hear wheezing in the lower part of your lungs. Do you feel that when you're breathing?
I think so, yeah.
Yeah. Okay, so I've got your vital signs and I've listened to your chest with some wheezing. The doctor's going to be coming in next. I'm just going to give her the results of what I've just done, and she'll come and visit with you, and then I'll see you after that.
Okay.
Okay, good. All right. Okay, I'm back. The doctor has heard the very same things that I heard. She's told me she's going to give you some inhalers to use at home. Have you ever used an inhaler before?
Yes, I have, but they even showed me how to use a spacer.
Oh, that's great. The spacer is supposed to help get the drug down deep into your lungs where it can work, where it's supposed to. And have you ever had 2 inhalers before?
No, why?
Well, they're 2 different drugs, and you need to know which one you should take first for the best medication usage for your body. So one of the inhalers opens the tubes in your respiratory or lungs a little bit bigger, so it should be taken first. And then when you take the second drug, it goes a little bit deeper. It can go, the passageway is bigger, so it can go down into your lungs better. And it's an anti-inflammatory, so that drug is best to go second, to get down to where the inflammation in your lungs is happening, causing you some problems.
I had no idea that it would matter which one I took first.
Yeah, you know what? Many people don't know that, so that's why I explained it, because if you understand, it makes so much more sense in how you should take them.
I learned a lot today, both inhalers.
Yeah, good. I'm glad I could help with the information and anything.
So what's next?
Well, I think you can go home with your prescriptions. The doctor wants you to come back in about 10 days and take another course of antibiotics, but the whole dose. And 10 days later from now, you can make an appointment. So you make the appointment today on your way out, and you'll be seen again then.
Okay, thanks for everything. I'll see you next week. Oh yeah, can I get that helpline number?
Oh, right, I did get it when I was out of the room, so here it is. It's for you, the helpline number, and you give them a call and see what happens.
Okay, thanks.
Okay, great. Bye. Bye-bye.
You will now have 45 seconds to review your answers.
Task 3 Patient Care. You will watch a dialogue between a nurse and a patient in a video scenario. You will get 45 seconds to read the questions.
Listen to the recording and select your answers.
Nice to see you again, Tom. How are you today?
I'm okay.
So I understand that since I was seeing you that while ago, that you're in hospital again.
Yeah.
So can you tell me a bit more about what happened before that?
Well, it was a few months ago now. Yeah, I'd done quite well for a number of years. Sort of kept it under control, really. But
yeah, I mean, I've not seen you since your gap year, wasn't it?
Yeah, so that was 4 years ago. And so yeah, it was quite disappointing to go through it all again. But it sort of started at the towards the end of university. So I was doing law, and I was on course for a first, and I was just coming up to my final exams, and I had a few essays and a few exams, and so I started working really hard. I felt like, right now, put the effort in and to put the work in. So I started to step a bit later, take on a bit more work. So my stress levels sort of started to increase over a while. I was drinking a lot more coffee, took a few caffeine tablets, and energy drinks. A few people, well, because sort of the environment at the time was a lot of people were pushing themselves that they wouldn't normally do, and some people were taking Ritalin.
Oh wow, okay.
Yeah, and
did you take any Ritalin?
Yeah, because it was just like it was necessary at the time. And
how did that affect you?
Well, it sort of increased my confidence at the time. Everything that was going on, I was becoming a lot more productive. A lot more confident. Was working harder. My brain was working faster, and so my momentum was building up and up throughout the period. And so I was relishing it, and I was doing a lot of work. And
so what did that mean to you then to be at that time? Because it sounds like you put quite a lot of pressure on yourself. You've been doing really well at uni, and this was it. This was the time. What did it mean to you to be feeling like that, kind of more awake and more energized, maybe? Yeah, well, for me it was my sort of time. So I'd spent 3 years. I was in control. I was doing well. It wasn't really part of my life at the time. I didn't really talk to any of my friends about it. But then I started to just sort of grow into it, and I took the opportunity to enjoy this time. And it didn't really reach its peak until after my exams. I was still functioning throughout my exams. I have since found out that I didn't get the results that I wanted to. Why do you think that was? Well, I thought that I was working harder than ever, but it was misjudged, I think, and so I didn't perform to the best of my ability when it came to the exams, and so I didn't achieve a first time. I only got 2-1. What else was happening for you around that time? I mean, you talked about the pressure of your exams and staying up for them. Was anything else going on for you around the same time? Well, so it was the end of university, and that was the time where, well, as soon as that period stopped of work, then I was sort of let off the leash a bit, and I just sort of to grow even further. So I mentioned I was taking Ritalin, drinking a lot of coffee, and as soon as exams had stopped, substance abuse sort of took a bit more of a hold, and I just sort of grew into this person who I thought was the guy that everyone wanted to be around and to see, and so I made sure that I was just everywhere that could be seen. I was, so this is like the gap after you finish the exams, but before the results are out. Those kind of few weeks. So we were just going out a lot, if not every night. You said that you were taking Ritalin and drinking a lot of coffee. Yeah. And using other drugs as well. Yeah, it sort of developed into cocaine, a lot of cocaine, MDMA, MCAT. And how did they affect you? I honestly was on cloud 9 at the time. And so in this sort of role as the man about town, I spent a lot on alcohol, drugs, clothes. I invested in this technology. Having not
had to deal with my illness throughout university, and for it not being a part of that world, I didn't confront those symptoms in a way that's going to have long-term sort of stability. It began with doing the work that I needed to do. That's just what I needed to do in order to achieve my goals and to achieve what I want to. And then I just let it take hold, and
You will now have 45 seconds to review your answers.
Task 4, Patient Care. You will watch a dialogue between a nurse and a patient in a video scenario. You will get 45 seconds to read the questions.
Listen to the recording and select your answers.
Now, have you had any pain since the operation?
Well, the operation site itself is okay.
Well, that's good, because it indicates that it is healing and I can see there is no infection.
But I have had some back pain.
That's normal, but can you tell me exactly where it hurts?
Mostly in the upper back, near the shoulders.
And is it affecting your sleep?
Yeah, it is a bit.
Okay, yes, that's perfectly normal, especially following chest surgery, and it will gradually reduce over time. Paul, what medication have you been taking?
I've been taking paracetamol, and if I have to, endone.
And has the medication been effective?
The paracetamol is not that effective, really. It doesn't completely relieve the pain, so I've been using the endone, which works really well, and I prefer to take that.
Okay, well, endone is more powerful medication than paracetamol, but it's very important to take the paracetamol for the pain, and you shouldn't really take any more than the prescribed dose, as endone is a Schedule 8 drug, which means it can lead to addiction if you take any more than what you have been prescribed.
Well, I can do that, but to tell you the truth, I have been taking it a little more frequently, and I've run out of endone, and I was hoping to get another prescription as it works better than paracetamol. Is that possible?
I'm a little reluctant to do that, as it can lead to side effects, but there are some other measures you can take.
Like what?
Well, stick to the paracetamol, and also by doing gentle exercise, relaxation, and focusing on other things rather than the pain. These things can really help.
Okay.
And as I said, you will find that over the next couple of weeks, the pain will gradually reduce.
You know, I do worry when I get pain, and I wonder whether it could lead to serious problems.
Yes. Well, I would like to talk to you about that. Now, you said your pain is on your shoulders and upper back.
That's right.
Well, as I said, that is normal, but the main things to look out for in include pain that is not responding to the paracetamol or endone.
Mm-hmm.
And if the pain is associated with nausea or vomiting, then that is significant.
I see.
And if the pain is radiating in any way, especially down your back or arms, that is a very important sign. But you've not experienced this, have you?
No, not like that.
Good. But if any of those symptoms develop, you'll need to get medical treatment as soon as possible.
You will now have 45 seconds to review your answers.